Hello there, my lovely. My name's Sarah and I'm an advanced paramedic practitioner. I believe you're not feeling too well. Yeah? Okay. Alright, well, I've been sent from your GP surgery to take a look at you, alright? Just to explain, I'm not a doctor, but I am qualified to identify and treat a whole range of conditions and also prescribe medications as well. Okay. Right, so let me just see what's been going on with you then, my lovely. Okay. You'll see me typing things into my iPad. Okay, this connects directly with your notes and updates your surgery and the hospital. Okay. Alright then. So you've been feeling very dizzy. Okay. A little bit nauseous. Alright. How long has this been going on for? Alright, okay. Have you had an infection, a cold or anything like that? Alright, okay. Do you still feel like you have that infection now? Okay, alright my lovely, let's take a look at you. Does the dizziness get worse when you change position? Okay. And can you lie down? You go very dizzy when you lie down, okay. Alright, okay. So I'm going to take a little look at you, alright, to see if we can work out what's going on and make you feel better today, alright? Okay, so firstly, I'm just going to have a little feel around the lymph nodes in your neck, alright? Okay, so you've had flu-like symptoms for about 10 days, okay? But your headache's got worse, alright? You had a lot of nasal discharge, okay? Alright, just you relax there, I'll take good care of you. It's normal to be anxious when you're not feeling well and it's a new symptom. Okay, I'm just feeling along the supraclavicular lymph nodes there and here too. Okay. Alright, a little bit swollen in the lymph nodes in your neck. Alright, so that would usually indicate an infection of some kind. Okay, I'm just going to pop this on your finger, my lovely. It's just a pulse oximeter. Okay, it just tells me the oxygen saturation in your blood and also your pulse rate. Okay, let's just pop that on there. Only needs to be on for a second too. Okay. Okay, perfect. So your oxygen sats are fine. They're at 98%, which is fine, and your pulse is at 88. Maybe a little bit faster than normal, but that's probably the situation that's making you feel a little bit more anxious. Okay, right. Are you on any medications at the moment? I can't see that you are. Alright, that's good. Have you been taking any medications for your infection? Just paracetamol, okay, right. Which leads me on nicely to the next part of the exam. I'm going to check your temperature, my lovely, alright? Just going to pop this thermometer into your ear. Okay. Any side? This one? Okay, I'll come around here and do that. Right, you just hear a couple of beeps, alright, my lovely, just relax there. Popping it in your ear now. do have a little bit of a fever still, at 38. So I'm guessing you've got a secondary infection of some kind from your virus. Alright. So, with the dizziness, are you noticing any pain in your eyes at all? Okay. I'm going to shine a light in your eyes now, my lovely. It will be bright, but for a very short period of time. I'd just like you to just look straight ahead for me. Okay. That's it. Don't move your eyes. I'm just going to be shining a light in and out briefly. Okay? Perfect. Okay, lovely. Alright, that's fine. Now, would you just follow the light briefly for me? Okay? So keep your head nice and still and just follow the light with your eyes. Okay? Alright, just up and down. Okay? Across and up and down. Alright. Oh, good there. Okay. Need to check your blood pressure. It's one of the key things we have to check when anybody has dizziness, just in case it's related to some kind of pressure change. Just need to pop my stethoscope on for this. Okay. I will give it a little warm up for you. They can be quite a shock when they're cold. Okay. So I'm sure you've had this done before, but I just need to pop the cuff on your arm and inflate it. It'll go tight, it shouldn't be painful, but you will feel some pressure. There we go. Just relax your arm. Perfect. Right. Let's get the stethoscope and pop that under there. It's lovely. I'm just going to inflate the cuff now, okay? Right. Just check that again there. No, it's fine. I just like to double check it when I'm doing it. It's always good to double check. Okay. Yeah, that's fine. That's fine. Take that off you now. Okay. I'm not going to check the other side today if you are feeling particularly dizzy, because it can make you feel a little bit more dizzy, so I won't do that. Right. Just want you to breathe normally for me. I'm just going to place the stethoscope onto your neck. Alright, okay. Okay, now I just want you to take some deeper breaths for me. So I'll pop that there and go in and out. Okay, and again. In and out. And again. And again. Again. Perfect. One more time there. Okay, just round the back a little. In and out. Okay, around this side. In say 99 for me? And again. Lovely. And could you give me a little cough? Okay. I am hearing a little bit of a wheeze on your chest. It sounds like there is a little bit of infection there. You've been coughing up some mucus. Okay. All right, my lovely. Just place those down there a second. Okay. All right. I'm just going to pop my hands under your ribs. Could you just take a deep breath in for me? Okay. And out. Okay. Just a little higher up now, and in and out. Okay. I'm just going to be tapping around your ribs and your abdominal area. Alright, tell me if anything feels uncomfortable, won't you? Okay. Okay, I'm just going to take a little moment to press around, alright? Okay, a little deeper this time. Okay, everything feels fine now. That's not hurting? Good, okay. Alright. Just going to have a little press around your face. Tell me if anything feels tender, alright? Okay. It hurts there, okay. And what about up the top here? Okay. Alright. Yeah, definitely feel that that's a sinus issue. Okay. I'm going to take a look down your ears, okay, to see if there's any infection going on down there, anything unusual. Is that alright? Okay. So I'll be using this otoscope. It has a light on it. This is going to just be inserted into the ear canal. Alright? Keep nice and still for me while I do it, won't you? Okay. Okay then, my lovely, so I need to just gently pull up and back on your ear and just insert the otoscope. Okay, keep nice and still for me. Pop up your hand if it feels really uncomfortable. Okay. Here we go then. Insert that now. There we go. Well done. Just having a look down your ear canal. There's some redness down there, and it looks like there's some fluid behind the eardrum. I can see the bubbles. Looks a little bit cloudy in there, so that would indicate that there's some otitis media, which is a middle ear infection, and a little bit of otitis externa, which is in the ear canal. Right, okay. Just reposition a second. Okay. Right, I'll remove that now. Okay. Very well done. You're right there. If you feel really dizzy, just tell me, okay? Alright. So, same again, just pulling up and back, my lovely, and inserting this now. Alright. Little this in the ear canal. This ear drum looks a little bit fluidy behind, but not as bad as your other ear, but I still think there's some infection going on. Okay, let me withdraw that now. Okay, there we go. Right, so let me take a little look at my nose now. I'll just gently push on the tip of your nose and insert the otoscope. Might feel a little bit uncomfortable, but only for a short period of time. Right. There we go then. Let's just push up there and just insert that now. Okay. Yeah, I can see some blood up there and some purulent discharge, mucus, so it looks like there's a sinus infection. Okay. And this side now, my lovely, okay. Just insert that now. Yeah, same up there. Okay, just relax there now. Alright, let me just take a little look down your throat. Okay. You know what's coming now, don't you? The lovely tongue depressor. Okay, sweetie, just open nice and wide. I'll do this as quickly as I can. Alright, okay, nice and wide. Perfect. Say R for me. Okay, and say R again. Okay, a little bit sore looking down there. Has your throat been very sore? Okay, alright. Okay. So could you just make some eye movements for me? Could you just look quickly to your left? Okay. And to your right? Okay. Could you quickly look up? Okay. And down. Okay. Does that make you feel more dizzy? Okay. Could you just tilt your head very slightly to the left? Okay. Very slightly to the right. Okay. Could you just pop your head up a little bit? Okay. Has that made you feel worse? Okay. Just relax there. Okay. So would you like me to give you something for that dizziness now? I can do that. Yeah? I can give you a tablet that dissolves in your mouth or an injection which works faster. You don't mind the injection? Okay, perfect. Alright, I'll put these over here. Right, I just need to get that together. I brought some medicine with me. Okay, because I thought if you needed something, at least I could give you something while I'm here for the dizziness. It also helps with the nausea, which is being caused by the dizziness as well. Brain's just getting a little bit confused in the same way it does with motion sickness, and it can trigger the nausea, which we don't want, do we? No. Okay, so I'm just going to get an alcohol pad before I do this. Have you got any preference to which arm? Okay. Just need to open the pad. do it in this side, shall we? Okay then. So let me just give this a good wipe. Okay, perfect. Right, you're going to feel a sharp scratch now. Okay, I'm just going to pop a little bit of this medicine in there. Alright? Okay, just move around to do that. Okay, alright, here we go. Sharp scratch now, my lovely. There we go. Well done. All done. Perfect. Okay. Right. That should work in a few minutes. Yeah. Okay. I can give you the tablet form of the prochlorperazine, and it will dissolve just inside your lip. You can do it just up there. Okay, so you don't have to worry about swallowing tablets if you're feeling nauseous. Okay. Right, just updating those notes as I go there. Okay. So have you had any pains in your limbs at all? Just a few aches? Alright. Yeah. Okay, that's understandable. I'll just have a little feel down your arms. You can tell me if anything does feel sore, and I'll check for any rashes while I'm here. Okay? Perfect. Just relax. You may feel a little bit sleepy after that medication once it starts to take effect, but that's okay. But if lying down makes you feel terrible, then just try and sleep as much as you can sitting up. Okay, I can't see any rashes, which is good. Skin looks healthy. Perfect temperature. Yeah, on the arms, yeah, that's okay. A little bit warm across your chest from the fever, but hopefully with the paracetamol that'll be under control, but you don't feel overly clammy or anything like that, so that's good. Okay, let's take a little look at this side. Nothing feels sore, no. Okay. Again, no signs of any blotchy rashes, patches, anything like that. Skin looks healthy. Okay, just going to take a look at the fingers. Alright, they look perfectly fine. Looks like there's good blood flow down there. That's fine. Just take a look here. Okay. Right. What I think we've got going on here is a secondary infection from a virus, like an influenza virus. Okay. Seems to be really concentrated around the sinuses and the ears, which would explain your dizziness. Alright. If there's fluid in the middle ear and the infection can get in the inner ear, it can really knock you off balance, and we need to get that treated. Alright. You've also got some irritation in the ear canal, and I can put a couple of drops in for that now, okay, but I'm going to prescribe you some antibiotics as well to get on top of that infection. Okay, so I'll issue a prescription. You're not allergic to any penicillin, are you? Okay, well I'm going to prescribe 500 milligrams of amoxicillin. Okay, we'll try 3 times a day. That should attack the bacterial infection in the sinuses and ears. Any problems with it, obviously just call the surgery, or if you're not getting better after about 4 days or so, again call back. Alright? Okay, that's gone straight over to the pharmacy. Could somebody collect that for you? Oh, okay. I'll tell you what, I'll be coming back this way later, so I'll pick that up for you and drop that off. Is that okay? Oh, it's fine. It's not a problem. I need to come this way. So I can do that. I'll put my little note on there. Alright, my lovely, so that's all sorted. I think actually I'll prescribe you some drops as well for your ears. So I'll get you some. Actually, let me just check. It's better in a spray form, actually. It's much easier to administer, so I'll give you some spray. And that will help calm down the ear canal problems. So I'll get them over and I'll bring those round later. Alright. So let's see what I've got over here. Right, I'm going to pop you some drops down just to calm the sore ears. Alright. This isn't going to do anything for the fluid behind your ear, but it'll help soothe the ear canal. Okay, my lovely? It won't make you any more dizzy. You're starting to feel a bit tired? Okay, well I'll be done soon, so you can relax and just get some sleep. Make sure you're drinking plenty, even if you don't really feel like eating much right now. Okay, right. Keep nice and still for me. Right, here's one. And two. Lovely. Okay, good. Let's do this side now. Here's one and two. Okay. Right then. Okay, good. Right, that's me all done. I just need to tidy my things up and I will pick up your prescriptions. Okay, all these notes have gone straight back to the GP surgery. Like I said, that's where I'm based. But they'll also be held on your records. If you ever needed to go to hospital, it will all be on there as well. But hopefully you won't need to go there. Okay. Lovely. Right. Let me tidy up my things and then I'll be on my way. And I'll pop back a little bit later. It's probably going to be about another 90 minutes. Alright. Okay. But try and get a little bit of rest. Okay, lovely. Well, you'll be feeling better very soon, I'm sure. Okay. But have a little sleep now you've had that medicine. Yeah. Okay then, my lovely. Well, I'll be seeing you a little later. Alright, sleep well. Bye bye.